Okay, all right, so let's get started. Thank you everybody for joining us today. My name is Frida Pineda and I am the TTA manager here at NCHPH, and we will be getting started with our webinar today on motivational interviewing for the prevention of alcohol misuse in young adults living in public housing. And this webinar is brought to you by the National Center for Health in Public Housing. This is just a reminder to everybody that your line is muted upon entry. Please make sure that you also engage in the chat if you have any questions or any feedback that you would like to provide to us. Please raise your hand if you would like your line to be unmuted during our Q&A session. The meeting is also being recorded, and the slides in the recording link will be sent to you all via email after today's session. And just to begin, we would like to know about you. So let us know in the chat your name, your title, and the organization that you're joining us from. Okay, so here we have some additional information about NCHPH. The mission of the National Center for Health in Public Housing is to strengthen the capacity of federally funded public housing primary care health centers and other health center grantees by providing training and technical assistance. The content of this webinar is 100% financed by the Health Resources and Services Administration and do not necessarily represent the official views of Hous, HHS, or the U.S. government. So with us today in the line, we have Dr. Jose Leon, who is the Chief Medical Officer at the National Center for Health in Public Housing. And then myself, again, I'm the TA manager here at NCHPH, and I will be co-moderating along with Dr. Jose Leon. And today we also have a very special guest speaker. His name is Frank Vitale. Frank Vitale is the National Director of the Pharmacy Partnership for Tobacco Cessation, has worked in the smoking cessation field since 1987, designing cessation programs, educating over 20,000 health center professionals in how to help patients stop tobacco use, and counseling near 10,000 patients to quit. He received his BA in liberal arts from St. Vincent College in 1974 and a master's degree in psychology from Duquesne University in 1988. He entered the field as a health educator, then as clinic coordinator for the lung health study, researching the differential effects of smoking cessation and an inhaled medication on the prevention of COPD in identified high-risk individuals. Frank followed this by becoming the project director of the lung health study too. He is currently a clinical assistant professor at Purdue's College of Pharmacy, working on a myriad of projects designed to train pharmacists, physicians, respiratory therapists, and other clinicians interested in adding cessation counseling to their practice. So for today's learning objectives, we'll be reviewing data on alcohol consumption among youth. We will also learn the criteria for alcohol use disorder and discuss how motivational interviewing can prevent alcohol misuse in young adults. So we would like to also obtain just some information on what your current knowledge is about alcohol misuse among young adults. And for that, we have created a few poll questions. So please go to menti.com. You can access it through your computer, your smartphone, or your tablet, and then enter the code 5488-5404. Or you can also just scan the QR code that we have on the screen. And whenever you're ready, so hopefully you are. So here we have some of the questions, and I will stop sharing my screen for now so that we can access the questions. Just allow me a brief second. I share the screen? Okay, so for our first question, what is moderate drinking? And this is a short answer question. In your opinion, what do you think is 3 drinks a day? Social drinking, yep, that's correct. Okay. All right, so we just have 2 responses, but yes, I think this is applicable for to moderate drinking. So for our next question, this is a myth or fact question. Alcoholic beverages are stimulants. Myth or fact? Okay. So the correct answer for number 2, this is a myth. Then is black coffee or a cold shower sobers a drunk? Is black coffee or a cold shower sober a drunk? Yep, that's correct. This is a myth as well. Thank you. And then for our fourth question, impaired driving is a major factor in car accidents among teens. Yes, that is a big fact. And then for the fifth question, you can't become an alcoholic by drinking only beer. Yep, that is correct. And then this is another short answer question. What are the consequences of failing to address the burdens of alcohol in teenagers? And then we will allow just about 1 minute for people to type in their answers. Yep. Alcoholism, drugs, death. We also have here lifestyle behaviors, dependency, social impacts. Okay, all right. Thank you everybody for participating in this interactive exercise. And I will stop sharing my screen. And let's continue with today's presentation. All right, I'll pass it on to Dr. Jose Leon to continue with today's webinar.
Thank you, Fide. Hello, everyone. Such a great pleasure to be with all of you and share some information with 2 great colleagues, Frank and Fide. We've done a lot on tobacco cessation, and this time we are switching gears and trying to also address another issue that is prevalent among those living in public housing. And it's important to cover it because we have other public health priorities in the United States. But due to COVID, the pandemic, as we have put some topics aside that are really important to revisit, making sure that when we have patients, when we have contact with our patients, regardless of your profession, either you are a clinician or you are a social worker or you are a CHW, is always, always important to develop this conversation with patients, making sure that we cover issues about recreational drugs. Right now, substance use disorders are focusing a lot on other substances, but alcoholism and alcohol in particular is one of the main concerns amongst teenagers. There is no data or health center data regardless of, I'm sorry, related to the percentage of teens who are drinking in either public housing or visiting health centers. There is one that is for all patients, all health center patients. And the question was part of the 2022 Health Center Patient Survey. The director of research here at the National Center for Health in Public Housing analyzed at some numbers, and we compared data of those living in public housing or patients going to health centers but living in HUD-assisted housing and all other housing. And if you see the numbers are relatively similar. We have about the same percentage of patients who have whoever used alcohol. However, when you analyze other numbers like the use of alcohol in the past 12 months or the discussed alcohol with a doctor the past 12 months, and specifically the last one, only 9.1% of those living in public housing had a conversation about this issue with the doctor, and then almost 11% of those HUD-assisted housing patients, and for about 14% of those who are not HUD-assisted patients. So there is the need to have a conversation with our patients about the use of alcohol and what we can do to help our patients. We are working with patients. We ask about the tobacco use, and if a patient is a current smoker, we refer the patient to some of the health center resources. We are not doing the same with a patient who are using alcohol. So let's make sure that we discuss this with our staff members just to make sure that we have that conversation with our patients. Next slide, please. This is data that is from NIH, and they collect data on those who are 12 to 20 years of age regarding the prevalence of drinking. I'm not going to go over all these numbers because we are going to share the slides with all of you so you can review the percentages. But there are two that I would like to pay if we can pay attention to while we have this conversation, and are the last two bullet points: the prevalence of past month binge drinking and the prevalence of past month heavy alcohol use. And if you see for binge drinking is about 8.6% and 1.7% for those who said that they have heavy alcohol use. Next slide, please. So we have some consequences, and this was part of the conversation that we had with FIDE during the Mentimeter exercise. And what are the consequences of underage alcohol use? First, let's remember that many of these patients are not adults yet, and therefore they react a bit different to any recreational substance. So they can have other issues since there is the need for them to experiment. Sometimes there are some other consequences like injuries or sexual assaults, overdoses. Somebody mentioned death, which is also included in the complications or consequences. And there is a factor that is really important to mention, and is the data related to death of people younger than the age of 21 in the United States, and about or over 1,000 of motor vehicle crashes in the United States were for the use of alcohol. So that's something that we also need to pay attention to when we have this conversation to our patients and talk about the complications and consequences. Next slide, please. So we've been talking about binge drinking and excessive drinking, but we also need to pay attention to when drinking in moderation is too much. There are several issues. If a patient is taking medications, or if the patient is doing some has a condition that can worsen the condition, the recommendation is from a medical perspective is to recommend patients, and let them know that they don't need to drink, or they don't have to drink alcohol. Then if the patient is pregnant, or if the patient is recovering from alcohol use disorder or any other substance use disorder, because this can create other issues. Patients recovering from the use of marijuana or tobacco or cocaine can also get addicted, and be addicted to alcohol when they are recovering from any addiction. Next slide, please. There are some criteria for alcohol use disorder. This is from the DSM-5. Again, patients, when you are talking to them, ask about tolerance, whether or not the patients are, how much they are, how many drinks they're having, either socially, as somebody mentioned, or if they have the desire, the strong desire or urge to have alcohol. Those are uh, cues that we can use, just to understand whether or not someone is um, having an alcohol use disorder, and making sure that we address the issue with our patients. Next slide, please. The criteria continue with how for instance, the even patients are having complications. Alcohol is affecting their social life, and yet the patient is still drinking. That is a patient that needs to be referred to the appropriate resources, having conversation with someone who can help the patient with any issues regarding alcohol use disorder. Especially, we are focusing here on teens, and we have teens with some of these issues, very young people. So make sure that we address these issues, that this is not something that if you have a patient who's coming from a vaccine or from any other issue, it's always important to ask whether or not these patients use any recreational drug. Next slide, please. So there are some questions that we can use when we're talking to our patients. For instance, if you have a teen and the teen says that he or she drinks, we can ask him how often, over the last week, the amount and type of alcohol, so we can take a look at any dependence issues, whether they can control the drinking, whether they have compulsion, which is if they are craving for a drink, or if they have issues that are more like than 2 years. So all these questions can help during the interview with a young patient, making sure that we are addressing that issue. Next slide, please. But in order to address an issue like this one, we need to make sure that we have that communication that we and Frank is going to cover the motivational interview part of it, of the conversation with our patients. It's not just to ask and have a checklist, you know, and just know checklist, and that's it, and the patient can go, you know, and we are not providing any recommendation or any advice to our young patients. So it's important that in addition to all these questions that we have here on the slide, we also create that communication and so the patient feels confident and has the trust to talk to us about alcohol dependence. Next slide, please. So, Frank, thank you so much for joining us.
All right, thank you, Dr. Leon. As everyone, or as Fide told you, my name is Frank Vitale, and I'm coming to you from Pittsburgh, beautiful downtown Pittsburgh, where it's now about 50 degrees. So we're thrilled that it's finally warming up here. I don't know how bad this winter's been where you've been, but it's not been very good here. So enough of a weather report. So as Dr. Leon said, I'm going to be talking to you about motivational interviewing. Now, as Fide told you, my background is in tobacco cessation. And you may be wondering, well, why am I talking to you since this is looking at alcohol abuse? Well, the motivational interviewing techniques that I'm going to be talking about are applicable to any kind of behavior change. So no matter who you're dealing with or what you're dealing with, these techniques apply. So you may be wondering, what is motivational interviewing? Fide, you need to give me the screen again. There we go. All right, so what is motivational interviewing? Well, it's different from what you probably are doing now. Most of us, when we talk to patients, usually are telling them to do something because we are the expert in that area, no matter what your field is. And that's appropriate. There's nothing wrong with that. However, it usually doesn't work with behavior change. If we start telling people what to do or telling them that we don't like what they're doing, what we end up becoming is their mother, hollering at them, wagging our finger at them and saying, you're doing something bad. And of course, just like we did when our mothers did that to us, our patients recoil. They resist. They don't want to listen to what we have to say. And on our side, we don't want to be in that role. That's uncomfortable for us. So motivational interviewing is a completely different way of talking to patients. And the definition right here, and this is the only thing I'm going to read directly off the slide, it's a skillful clinical style for eliciting from the patient their own motivation for making behavior change. So remember this, most people change behavior when they make the internal decision to do so, not because somebody else told them to. Okay, think about that. Yes, if you nag somebody enough, maybe they'll make a change in behavior, but it's not going to be long term. So I'm having trouble changing the slides. Oops, now I went too far. All right, I'll get it. All right, so in other words, you want to guide the patient to tell you that they want to change rather than you telling them they have to change. Again, this is very different. If somebody makes the internal decision to change, they're more likely to do it. So this is a way of helping them get to that point. Okay, so we're going to be talking here about how to do that for the next few minutes. Now, if you go to a motivational interviewing training, and I would recommend that you're all involved in something like that, they're usually from 1 to 3 days. So obviously we only have about 20 minutes here. So I can't really go into all the detail that I normally would in a training like this. However, I approached several trainers in motivational interviewing and asked them, if I only have 20 minutes, what do I cover? So they've given me some very essential ideas here, some very essential concepts that I'm going to impart to you. So before I do that, I want to just emphasize, this is not about hollering at people, forcing them to change, intimidating, nagging, guilt, anything like that. Avoid all of those negative aspects of talking to a patient. The benefit to this approach is that you're going to avoid getting frustrated on your end with these so-called non-compliant patients. This then allows you to step away from that role of the parent, as I just said, and helps you establish a sense of collaboration. So this is the two of you joining together to help find a solution to the problem. And the belief here is that the patient knows what they need to do for themselves to make the change. They just either don't have the motivation, or they don't know how to do it, or a combination of both. So that's what we're helping them find. So the word here is encourage. You're not making anybody change. So how do you encourage change? Well, first of all, understand that most people, when you approach this topic of quitting smoking, losing weight, reducing their drinking, they're ambivalent about making the change. I mean, think about yourself. Any big change you've ever made in your life, it's not, most of the time, something that you just said, way, yay, I'm going to do this, and boom, and go do it. You know, you're a little, maybe I should, maybe I shouldn't. I also want you to look at this as a process, a learning process. Any behavior change for most people doesn't just, boom, happen out of the blue in a one-time event. This is a process that occurs over time. And relapse, although this doesn't mean you encourage it, is a natural part of the process. What you want to do is ask the patient, what did you learn about yourself during this last attempt to do whatever? And then you want to encourage change talk. So what is change talk? What's the goal of it, first of all? Well, it's to collaborate with the patient to help them find a motivation for change. In my 38 years of working with people quitting smoking, the biggest issue for most of them at the beginning is they don't have a real good reason to do it. There's no internal motivation. So that's essentially what you're helping them do. You're also helping them understand that the change, whatever that is going to be more enticing than what they're doing right now. And this is important. We want you to help them believe that they can change. If a person comes into this process thinking they don't have the ability to do it, guess what? They don't have the ability to do it. So part of our role here is to help them understand that they can change with the right tools. So what is change talk, or why do change talk? Because, as I said before, it's more likely to occur when the idea comes from the individual, not from you. All right, so how do we create change talk? In other words, you want those words to come out of the person's mouth themselves. So that's what I mean by change talk. So motivational interviewing helps you do that. Here are the 5 key components. Again, I'm just going to go through these very quickly. There is a reference slide at the end of this if you want to get, there's 2 books written on this subject, or you can look up trainings. They're all over the country. But these are the 5 essentials. Ask permission, use open-ended questions, listen reflectively, summarize your feedback, and then be very adept at rolling with their resistance or ambivalence. Don't let that get you. There are many sample language sentences on these slides. I'm not going to read them. Essentially, the first one is pretty obvious. Don't just say, I need to talk to you about your drinking. Ask permission. 99 times out of 100, the person will say yes. If they say no, then you can say, well, what's going on that you don't want to talk about this, or, some type of question like that. So again, this also gives the person control rather than you controlling them. Secondly, and if you take one thing away from this, this should be it. Ask open-ended questions. Start getting used to asking those types of questions whenever you're talking to a patient, because what they do is they engender conversation that then gives you information that you can use to help the person change. If you just say, don't you know you should stop drinking, or don't you know drinking's bad for you? What are they going to say? Yes, that's not a conversation. That's just a question and an answer. So you don't want to ask those types of questions. Now, Dr. Leone showed you a lot of questions a few minutes ago that are fact-driven. Well, you have to know that. There's some stuff you have to know about the person. There's nothing wrong with that. But when you go into the part of your conversation where you're looking at engendering change, you want to ask open-ended questions. And what two words should most open-ended questions begin with? I'll give you 1 second. What did I just begin this sentence with? Okay, it's the word what and how. If you think about it, those asking a question that way kind of forces the person to give you an elaborate answer. Like, what do you think would happen to you if you drove drunk tomorrow? Or what do you think might happen if you don't quit drinking in the next year or two? I would avoid using the word why, because in the English language, why implies that you're judging the person. And you can ask the same question with what or how. If the person is reluctant after you ask a few questions, I love this kind of question. What would have to happen to you for you to consider quitting drinking, losing weight, quitting smoking, whatever? This is a really powerful question. What would have to happen to you for you to consider blank? All right, here are two other types of questions that you can ask. And I'm sure you're familiar with this. This is pretty standard in any kind of behavior change training, the importance ruler. So how important would you say it is for you to stop drinking? And then you do the one, the scale 0 to 10. I'd like to play a little game with this in a sense, because if somebody says they're only a 3, I always say, well, you know what? From our conversation, I think you're a 6. So if you kind of go up the scale, that kind of encourages them to consider that maybe they are, rather than going down. Confidence ruler, same kind of thing. If you decided to stop now, how confident are that you could do it? And again, 0 to 10. Now, if somebody tells you a 1 or a 2, then I would ask them this question. What accomplishment are you most proud of? And trust me, I know this sounds simplistic, but I've seen it work wonders. What accomplishment are you most proud of? No matter what the person says, they may say, I climbed Mount Everest, I paid my way through grad school, I raised 2 children on my own. Your immediate response is, if you can do that, you can quit drinking, quit smoking, whatever. This is really a very powerful way to get people to think, oh, wow, yeah, doing what I did is much more difficult than what I'm going to be doing now. And it's a great way to boost confidence. Okay, so that's the questions. Ask permission, open-ended questions, then listen reflectively. And you do this by using the patient's own words back to them. So I hear you saying that quitting is very scary. Try to use those words because then the person knows that they're being heard. You summarize your feedback. Again, this is a nice way to end a session that gives in a sense, it gives somebody homework when they are leaving the session, in between sessions, something to think about, something to do. I always try to give somebody, a little bit of something to carry over between the sessions. Now, if somebody is ambivalent, if you hear that, then here are some sample languages some sample language that you can use. But the idea here is that ambivalence is not bad. It's only problematic when you get stuck there. So it's a natural part of the process, and it's a way of the person kind of evaluating, is the old better than the new? Is the new better than the old? So a way to help them resolve that, and you're probably familiar with this too, excuse me, is the decisional balance sheet. So it's just simply getting a piece of paper, putting, in this case, I continue to drink on this side, I stop drinking on that side, and list the pros and cons. What I have found with my patients who want to quit smoking is they can come up with verbally a million reasons to continue to smoke and not very many to stop. However, when you have them, prompt them to write it down, it becomes the opposite. It's very difficult for them to see it in writing that, you know, they're trying to justify their drinking, and they're more likely to find reasons to not drink. So this all comes together then, as I said at the beginning. Your goal then here is to establish a strong, clear internal reason for making the change. Okay, and this is going to be different for everybody. And there are no bad reasons to make a change. We have a few minutes here, so let me just give you an example of someone I worked with who, about quitting smoking. So this woman had a chronic obstructive pulmonary disease and was in a study I was in, and she should have quit long before she saw me. But, you know, she really wasn't too motivated, too interested, etc. Until one day she came into my office and she was frantic. She said, "Frank, I have to quit smoking right now." And I said, well, you know, what's going on? She said, no, you don't understand. I don't have a minute to lose. I have to stop right now. And I said, oh, well, you know, I'll be happy to help you. You know that, you know, you've been involved in this study. That's what I'm here to do. But I'm just curious, you know, what happened that you're so interested in quitting now? Before she answered me, I added something like, oh, I bet you were just at the doctor's office across the street and you got some bad news about your health. And she looked at me and she said, no, this has nothing to do with me. It's poor little Fifi. Now, who is Fifi? Well, believe it or not, Fifi was, I'm sure you guessed this by now because of the name, was her poodle. And she was at the vet's and found out that Fifi had asthma and lung disease because of being exposed to secondhand smoke. Now, you may be laughing, and I kind of myself did inside. And by the way, that is very accurate as far as smoking goes. Dogs, cats, and birds can get lung cancer and lung disease from being exposed to secondhand smoke. So I'm kind of giggling inside, but on the outside, I said, you know what, Mary, that is a fantastic reason to quit, and I will do everything I can to help make a healthy home for Fifi. Now, you may be thinking, well, she should have been concerned about her own health. Well, yeah, maybe she should have, but that wasn't really motivating her before this. This was, so I did not say one word to her about her own health. I just focused on Fifi. We worked for a couple of weeks. She was able to quit, and every time she came in for a follow-up visit, my first question was, how's Fifi? So the point in telling you that is there can be some very eccentric, out-of-the-box, unusual reasons for someone, in this case, to want to quit drinking. If that's motivating them, if it's strong, and if it's not hurting anybody else, then go with it. Now, you can clearly look at how the alcohol is affecting someone's health. You know, I do that all the time with cessation, with tobacco. But I do not talk about dying. Okay, and why is that? Well, everybody knows on some level that you're going to die. It's more important to look at how their abuse of whatever they're doing is affecting their life. So the question is, can you live with the consequences of your behavior? You know, what is it like to be smashed every morning and not able to get up to go to work? Or in the case of someone who isn't going to quit smoking, what would it be like to be walking around with an oxygen tank because you have such bad COPD that you can barely breathe? So you're looking at how it's affecting their health, but also the quality of their life. That's much more impactful because it's immediate. Death is some way far out thing that may or may not happen. Well, obviously will happen, but in their mind, it may or may not happen for many, many, many years. So it's not something that's immediate, but focusing on how this is affecting their health, I mean, their everyday life is. So looking at the consequences of their behavior right now. How is this affecting family? How is this affecting their social life? Money. One of the things that I do all the time with my patients who smoke is figure out how much they're spending every year on cigarettes. And in most cases, it's $3,000 or $4,000 a year. It's very expensive. And alcohol, as we know, is even more expensive. So help adding, if you add up that and they look at it and they say, oh, wow, I'm spending $10,000 a year on, booze. Well, that's, something they never thought of before, and they may not, probably don't have $10,000 a year to spend on it. Most people who smoke don't have $3,000 to $4,000 a year to burn up on cigarettes. So that can be another motivator. But the reality is that whatever it is, you want to strengthen that, encourage that, build that up as much as possible. So that's the whole goal of motivational interviewing. So the final reminders here, you can't make anyone change. If you try to do that, they're going to resist. So the more you push, the more they're going to push back. Your role here is to help them want to change by increasing their displeasure with their current behavior and decreasing the fear of the new. In the end, though, you should always present the reasons for the change and then let the patient make the decision. Now, if somebody says to you, I'm not ready to do this now, don't just say, okay, come back when you are ready. Your role is to help them get ready. So that is where you can use all these motivational interviewing techniques. And finally, if you want more information, and I hope you do explore this, these are the people, Miller and Rolnick, who in more or less invented motivational interviewing. But it's very similar to what I learned in my psych program and in doing counseling with patients. So that doesn't mean you're going to become counselors or therapists, but they've taken those nitty-gritty concepts and put them together, and that's where they've come up with motivational interviewing. And it works. It really does. So I want to encourage you to, at the very least, start asking how and what questions. Now I'm going to turn this back over to Dr. Leon. He's going to show you a video that shows you someone using motivational interviewing techniques, and then give you a few concluding remarks.
Thank you, Frank. And great presentation. Thank you so much for all the tips. Those are very useful when we have conversations with patients, and specifically when we have conversation with teenagers. At the National Center for Health in Public Housing, after we have a webinar or an activity, we always like to show how to use the concepts. Sometimes we do case studies, we have some conversations about the topic. And while doing research for all of you regarding motivational interviewing and the use of motivational interviewing in young adults, we came across with this video showing the techniques that and the tips that Frank mentioned. So we are going to see here all the recommendations and advice that Frank mentioned during his presentation. This is a short video, it's just 6 minutes. And after the video, we will have some Q&A. So whatever questions you have for either me or Frank, please make sure to use the Q&A box. Or if you want to ask the question verbally, you can also use the raise hand icon and your line will be unmuted. And Sophia, please play the video. There is no audio. Fide.
Okay, let me see. What about
About how that happened.
Okay, let me go back just a little bit, right at the beginning,
Okay.
right here. Yeah, there.
and result in healthier future babies.
So I know we determined that you sprained your ankle yesterday, and I'm wondering if you can tell me a little bit about how that happened.
It's really stupid. I was at a pub crawl last night, and you know how pub crawls are, you have a few drinks, and I thought it was a really good idea to catch up with my friends who were, yeah, they're in front of me. So I just like jumped off the stairs of the bus, and I was wearing these like stilettos because there's a 90s themed pub crawl. Anyway, and I just like fell on my ankle. Really embarrassed.
Sounds like a wild night.
Yeah. But I didn't do any dancing after that.
You know, I guess that would be the end of your shaking and moving. I know. I wonder if you'd be open to exploring your alcohol use and what that looks like during the week.
Sure. As long as we don't talk too much about like vodka, 'cause I'm still
You're
a
still
little,
feeling the effects of
yeah,
it, are you?
a little bit.
Oh, wow. It was really a rough night.
It's normal.
So what is a typical week for you as far as your alcohol use?
Well, my friends kind of we party on the weekend, and you know we're all university students, and so it's just normal to have a few drinks.
So a few drinks is nothing new to you.
No,
And what's a few drinks look like? Is that per night? Is it 2 drinks?
per night, like if we go out, oh, it's a lot. It's like I can drink probably like 7 or 8 drinks, like going on hard. And then you know, like maybe when I get home from school, a long day at the library, to a beer or two. So,
All right. Do you have any concerns at all about your alcohol use?
well, I don't know, it's normal for university students, I feel.
Okay, so at this point, you're not too concerned. You think that, you know, this is what the other students are doing.
Yeah.
Would you be open to kind of looking at the low risk drinking alcohol guidelines?
Yeah, sure.
I don't know how you're feeling right now, but I'm just wondering if we can take just a quick glance at this. And what safe limits are for women is 10 drinks for women a week with the 2 drinks per day.
Oh, really?
Yeah, wow. Where do you feel you fall into that?
I would say I'm a little over that,
Okay, okay.
especially with midterms coming up.
Okay, so it's kind of a way to cope through stress.
Yeah.
All right. And is that something that has been, you know, way of coping for a while?
Yeah. Yeah, I guess.
Okay. Does that concern you at all?
I mean, the 10 drinks seems like not a lot, for like for me and my tolerance. So I've kind of built it up over the years. So that's a little bit concerning, I guess, to me.
Do you feel like you have any reasons to kind of bring your alcohol use down and within the limits?
Uh, any reason to? I guess health reasons.
Tell me more about that.
Well, I mean, clearly I don't feel good right now. And I definitely feel more productive when I don't have a hangover. So
Yeah. So you can see some advantages to reducing the amount of drinking
yeah,
that you consume during the week.
yeah.
Is this something you would be willing to explore with me a little further at another time, maybe when you're feeling a little bit better? Is this something you'd be willing to come back and talk to me?
Yeah, yeah. I think when I'm feeling a little better too, I haven't gone all out the night before. It's better.
We'd love to set up an appointment for you if you can come in later this week or early next week to kind of explore this a little bit further and maybe some of those advantages of reducing it to the safe limits. Is that something that we could do?
Sure. Yeah, just not on a Saturday morning.
That's okay with me.
Okay.
Thank you.
Yeah, that sounds good.
Thank
Talking
you, Fide.
about their alcohol use in a non-drink.
So this is a really good example on how to use what Frank was explaining, how to ask open-ended questions and how to make sure that the patient is the one finding the reason to stop drinking in this case. So it has many of the techniques and tips that Frank mentioned, and is a really good way to have a conversation with a teenager who sometimes are more likely to not have a conversation like this one with us. If we ask questions that are they don't like, probably we are not going to get additional information from the teens. So it is always nice to create this trust with our patients, making sure that we are addressing the issue and the patient is the one making the final decisions. Frank, do you have anything else to say?
Yeah, just two things. So first of all, if you don't say anything, what happens is that the patient comes away with the mistaken impression that what they're doing is okay. Now, trust me on that. I've heard it a million times with my patients who smoke. They'll come to me and I will start talking to them about this and they'll say, well, I just was talking with the social worker, or the doctor, or the nurse, and they never said anything. So in a sense, if you don't say anything, you're giving them tacit approval to continue the behavior. So I think it's very important, just like tobacco use, you need to address this in almost all of your interactions with somebody. Now, if you know they don't drink at all, then of course you can skip that. But I want you to think about it from that perspective too. And secondly, you may be thinking, oh, this is impossible. It won't make any difference. You know, they're going to do it. They're not going to stop. And, you know, again, going back to my experience with smoking, you know, if you think back 20, 30 years, you know, most teenagers, or I would say good, you know, 30, 40% of teenagers are smoking. In fact, that's when most people started. And in the 50s and 60s, half the population was smoking. Well, on the last survey that was done a year or two ago, and this is accurate, only 2% of teenagers are now smoking. It's almost unheard of in most areas of the country. Now they're vaping, you know, I'll give you that. So it's you know, they're still doing something that is harmful, but they're not smoking. So these techniques do work. You know, it may take a few years, you know, and collectively an individual may have to hear this from many different sources, but it does work and it can be done. So don't be discouraged or thinking that no matter what you say, it's not going to make any difference.
Thank you, Frank. And we have time for a couple of questions. Fide, would you like to give the instructions for the Q&A?
Way.
Yes, of course. Yeah, so if you have any questions, you may submit your question through the chat or through the Q&A button. So we're gonna allow maybe like a few minutes for people to provide their questions. And in the meantime, while you're thinking about your question for our speakers, I just wanted to remind everybody that we have a post-evaluation survey that will pop up on your screen after the session. So please let us know how we did. Your feedback is greatly appreciated. And also we have some upcoming activities in the month of March. So we will be sharing this with you all after the session so that you can have the registration link to a few learning collaboratives that we have coming up on enhancing services for older adults living in public housing, in another learning collaborative on smoking cessation, and also a webinar on reemerging infectious diseases.
Thank you, Fide. And I would like to mention, that this patient that we saw on the video, the patient was not coming to get any advice on alcohol use or misuse. This patient was coming for something else, and was the doctor, who asked about the how she had an issue with her ankle, and that how the conversation started. So we need to make sure that regardless of the reason the patient is coming to see us, that we offer, or open a conversation where we can get additional information from our patients. That's very important to mention. And I don't see any questions, Frank, but I do have one for you regarding motivational interviewing. And if this is related to how can we find, or how can a patient find, I mean, you mentioned the family, personal motivation, or family motivation, even the pet, and Fifi. But how can we get into the conversation that the patient finds, something that it really is going to trigger the desire to stop doing something?
Well, I think I think the obvious place to start is with health, because that's probably something that all of us, on this session have some access to that information or, familiar with. But I think you start looking at their, just having a general conversation about their life, what their interests are. Again, somebody may be wanting to run marathons, or wants to train for a marathon, but they're drinking over the weekend, and they're in bed all Sunday morning, or just in something off the top of my head. So knowing what their lifestyle is, what they like, what their interests are, what their family situation is, maybe give you some insights where you can suggest, is it possible that you're thinking about getting pregnant? So would that be a possible motivation for you to want to quit smoking? So it kind of takes a little bit of getting to know your patient, and then starting to throw out some possible motivators. But I think in most cases, just having a conversation with somebody, you're going to pick up on something that could be a motivator. Or you can just come right and ask, what would be a possible motivation for quitting?
Thank you, Frank.
And again, I think the other one that you can do with everybody is to add up how much they're spending on these habits, these behaviors. That can be, a very objective way to start a conversation, and just point out, hey, look at all the money you're spending on this. So that's another way into it.
Thank you, Frank. Fide?
Yep. Well, thank you so much, Frank, and thank you, Dr. Leon, for a wonderful presentation today. And also, I did wanted to remind you all that all of the recordings for our webinars, you can access them on our website at nchph.org. And this is our contact information. If you have any follow-up questions for me, or even for Frank, that I can also refer him to, you may email me at fida@mgt.com, or for Dr. Leon at jose.leon@mgt.com. And thank you all for joining us today. It has been a pleasure, and I hope you have a wonderful rest of your day.
Thank you.
Thank you. Goodbye.